Welcome back everyone, Felix here, Advanced Clinical Practitioner with Eden Clinic. In part 2 of this series we had a look at some fairly common standard TRT protocols from the NHS sector, with the exception of perhaps testosterone propionate. If you've not seen parts 1 and 2 of this video series, be sure to check those out just here, or you can click on the links on the screen at the end of this video. Today is the final installment of this 3-part video series, so let's have a look at what happens when we use the same esters already discussed in part 2, but in private sector practice, where there's a little more leeway to adjust dosing interval and frequency, and also method of administration to better treat our patients as per their individual needs and responses to therapy. This is actually known as off-label prescribing. So let's go right back to testosterone undecanoate, aka Nebido. This time let's look at what happens when you inject 125 milligrams intramuscularly once a week. So on the graph there straight away you'll see that it's easy to see that the journey to steady state is much faster and there's less fluctuation indicated by those smaller peaks and troughs daily. This in turn leads to improved psychological well-being and a reduction in the incidence of negative treatment effects. What about Sustanon then? Personally, I'm not a huge fan of Sustanon because with pharmacology I like to keep things simple, and as we mentioned there's 4 esters in there. However, it is an affordable option for some people and I've seen many patients get on quite well with it in clinical practice. Now let's have a look at how things pan out when we inject 125 milligrams every 5 days via the intramuscular route. Again, we're looking at the amalgamation of all 4 esters within Sustanon just for ease. So as you can see on the graph there, at first glance it may appear that there are still high peaks and troughs, but it's the reduced time in between these peaks and troughs that lead to improved symptom resolution and reduced negative treatment effects over the longer term for some. Now let's look quickly at testosterone enanthate with 50 milligrams injected via the shallow intramuscular route every 3.5 days. You'll see on the graph there that the more stable levels are reached with smaller differences between those peaks and troughs. Still, the difference between the peaks and troughs could be reduced further, which could ultimately lead to improved patient outcomes with minimal negative treatment effects by injecting daily or every other day. Now let's have a look at the commonly used esters and protocols used in private sector practice. Let's look at testosterone cypionate and enanthate, because remember those are almost identical on a molecular level and can be used in the same manner interchangeably. With the extended half-life of both cypionate and enanthate, it allows us to make adjustments to dosages that do not immediately result in a large peak or trough in serum concentration levels in the blood, the opposite of what occurs in fact with shorter esters like propionate. Now, I'm quite a fan of attempting to mimic our natural physiology, and anybody who's had both an academic and clinical background will have been taught about and applied to clinical practice the fact that testosterone synthesis occurs in a diurnal basis and is released just as you can see on the screen here. Now, there's a growing body of evidence for the use of smaller and more frequent dosing of all medications, and this can be applied to TRT also. The attempt, I think, is to mimic that natural slow release throughout the day, so let's have a look at how things transpire when we use daily smaller doses of testosterone cypionate or enanthate via the subcutaneous or shallow intramuscular routes respectively. These can be used in conjunction with HCG if you wished, and be sure to check out our series of videos on HCG just here. As you can see from the graph, there's much smaller fluctuations and a quicker time to steady state. This can lead to better outcomes over time in terms of both symptom resolution and reduction in unwanted negative treatment effects. It's also notable how similar the pharmacokinetic profile of enanthate and cypionate are, which is again why they can be used interchangeably. And finally, there's some growing thought out there about the use of a hybrid protocol of cypionate and propionate given in a daily dosing schedule but alternating between the two every other day. These are mostly anecdotal reports out of the USA, so I hear some patients are responding well to this. And it's thought that this may be due to the short and longer half-life preparations, potentially mimicking that diurnal fluctuation that occurs naturally in a healthy functioning HPG axis, which we mentioned earlier, but without the complicating factors associated with the other esters present in Sustanon. The shorter propionate ester mimicking that morning boost, with the longer half-life cypionate providing that stable baseline. This can be seen in the graph that you see on screen now. Whilst the peaks and troughs are high, they're close together, so that theoretically indicates a lessening of the likelihood of negative side effects. So there we have it everyone. That wraps up this video series on testosterone esters and how they can be used and the theory behind the rationale for differing treatment options. At the end of the day, at Eden we want to find the treatment protocol that works best for you, rather than dictating a protocol that should work. Everyone is unique, and this includes how we all respond to medications. At Eden, we'll try and work with you to find a treatment protocol that helps you feel the best that you can. The caveat to that is that this will only happen if you put in the work too. As Dave Lee says, testosterone is not a panacea cure-all. Be sure to go and check out Dave Lee's content on YouTube. Highly recommend. If you enjoyed this video, guys, please hit the like and subscribe button and make sure you hit that bell notification so you don't miss any of our future uploads. And I'll see you in the next one.